And I'm now turning it over to MP John Eldig.
Good afternoon, everyone, and bonjour. My name is John Aldig, and I'm Member of Parliament for Cloverdale-Langley City. Thank you, Kim, for being here with us today and for acknowledging the land on which we stand. I'm pleased to be here today with my colleague, Suk Dhaliwal, good friend and Member of Parliament for Surrey Newton, as well as Megan Dykeman, Parliamentary Secretary for Community Development and Nonprofits and MLA for Langley East, Andrew Mercier, Minister of State for Workforce Development and MLA for Langley, Selena Robinson, Minister of Post-Secondary Education and Future Skills, and the Honourable Premier of British Columbia, David Eby, as well as the Right Honourable Prime Minister of Canada, Justin Trudeau. I'd also like to join us, or also joining us today are Councillor Leith White and Deputy Mayor for Langley City, Rosemary Wallace. We are at the beautiful Kwantlen Polytechnic University here in Langley. KPU offers an outstanding nursing program for students studying here in the Fraser Valley. We're gathered here today to talk about healthcare. This is an especially important and personal conversation for me. As some of you may know, I'm the proud husband of a doctor. My wife Elaine has dedicated her life to serving, healing, and helping Canadians in hospitals, working hard to make sure our citizens are well looked after. I've always appreciated her commitment as a frontline healthcare professional, though I certainly grew to appreciate it more when the COVID pandemic broke out. Today we're here to talk about new and enhanced healthcare support for Canadians. We're also here to recognize the perseverance and compassion of current and future frontline healthcare professionals, like the amazing nursing students here at KPU. Without further delay, it's my honour and privilege to introduce our Prime Minister of Canada, the Right Honourable Justin Trudeau. Thank you. Merci.
Bonjour tout le monde. I want to thank Kim for acknowledging, as we all do, that we're on the traditional unceded and shared territories of the Coast Salish peoples, the Katsi, the Kwantlen, Matsqui, and Semiahmoo First Nations. Et merci, John, pour ton introduction et pour tout le travail que tu fais. It's always great to be here to visit you in Cloverdale-Langley City. Thank you for everything you do for this community as an extraordinarily important voice for them in Ottawa and a great member of our team. Also really happy to be here with Suk Dhaliwal, our MP for Surrey Newton, who is also a very strong voice for Surrey. And I can add that Minister Carla Qualtrough wanted to be here today as well, but wasn't able to join us. But she is on the credential recognition file and job training file, which is so important for everyone today. Premier Eby, David, it's always an incredible pleasure to be here with you. We've worked together extraordinarily well on a lot of different things over the past number of months, and we will continue to. And the healthcare announcements we're making today is just another great example of that, and really happy to be here with Minister Robinson, Andrew Mercier, and Megan Dykeman as well. And also, Deputy Mayor, thank you very much, Rosemary, for welcoming us here to Langley City. I also want to thank Kwantlen Polytechnic University for having us today and give a special shout out to the students that we got to meet earlier. Some of the students I met were internationally educated and are getting training so that they can practice here in Canada. I asked them about the reasons they chose to come to Canada and the work they were doing in the healthcare system, but not to the level of their qualifications yet. And it's great to see that alongside local students who are getting to be RNs and psychiatric nurses, we have international arrivals who are now permanent residents or citizens who are going to be contributing to the fullness of their potential and abilities to the pressures we're having on our healthcare system. We're glad they're here, and we absolutely need their skills and their dedication, because across Canada, healthcare workers have been stretched to their limits. They're working doubles and overtime to be there for patients. They're going above and beyond to make up for staffing shortages. Nos systèmes de santé sont confrontés à des défis, et ces défis affectent les membres du personnel et les patients. That's why our government has laid out a plan to strengthen public health care across the country, working hand in hand with provinces. This plan will make major investments, but we know that money alone won't fix everything. So we also want to work with provinces and territories on bilateral deals that will deliver real improvements that people can see and feel. So I'm so glad that today we're able to officially announce that the federal government and the government of British Columbia have reached an agreement in principle that moves us forward on healthcare. Thank you, David. In fact, I can actually add one more to the list today. We now have a signed agreement with Saskatchewan as well. We're glad to have them take the step with us and be part of improving our healthcare systems across the country from coast to coast to coast. Both provinces will join the 7 others that have already signed on in creating 3-year action plans that map out exactly how they will use these funds to make the improvements that Canadians are counting on. On a maintenant conclu une entente avec 9 provinces et on prévoit annoncer très bientôt des ententes avec la dernière et les 3 territoires. Chaque entente conclue représente un pas de plus dans la bonne direction pour améliorer les prestations des soins de santé. Each agreement will be tailored and flexible to the needs of each province and territory, but consistent among all is the joint responsibility to collect information that monitors how the healthcare system is performing so we know that it is delivering the improvements that Canadians deserve. Things like the percentage of Canadians who have access to a family doctor or nurse practitioner and tracking to make sure that that percentage keeps increasing. Or how long wait lists for appointments and surgeries are, and whether they're decreasing. More access to mental health care and substance use care, which I know is a shared priority with our partners here in BC, where you're all on the front lines of the opioid epidemic, and moving towards a more modern system that allows for you to securely share your health information with your entire healthcare team. We're doing this because what gets measured gets done. Another element of our plan is asking provinces and territories to improve how we recognize foreign credentials for health professionals so that it's easier for nurses like the ones I met here at KPU Langley to get their careers started, treat patients, and be part of easing the pressure on our overworked healthcare professionals. We're also committing $2 billion for an Indigenous Health Equity Fund to support First Nations, Inuit, and Métis partners in closing healthcare gaps. Une fois de plus, je tiens à remercier le Premier ministre Eby de nous avoir aidés à conclure si rapidement cette entente de principe. Fixing healthcare is a big issue, and we know we can't solve it overnight. But our government will continue pushing forward together with our partners so that we can deliver real results for Canadians and uphold the principles of publicly funded universal healthcare that Canadians are so rightly proud of. Merci tout le monde. I'm now very happy to turn it over to Premier Eby. David.
Thanks, Justin. Well, it's a pleasure, Prime Minister, to see you here in Langley and in British Columbia, and really wonderful thing to see colleagues from the federal side and to join you with colleagues of mine from the provincial side, our Minister of Advanced Education, 2 of our local MLAs that work hard for Langley and Langley City every single day. So good to see you here. And I'll point out that Minister Mercier is responsible for credential recognition, which is a critically important issue in our healthcare system right now, and Megan responsible for community development and nonprofits who deliver many of the sort of prerequisites for health to keep people out of the healthcare system. So really glad to see you all here today. Now, I'll begin by acknowledging we're on the territory of the Coast Salish people. It's great to be here at KPU. What we saw today were students who are hard at work, training for a career in nursing. Many of the students, as you heard from the Prime Minister, are new to British Columbia. They're excited to build a career here. We talked to Alita from Thailand, who's joined us here in BC. She started working as a care aide when she came to British Columbia, and now she's doing her registered nurse training here at KPU to go the next level. Also talked to Sherwin, and Sherwin had a career as a mental health worker in community and saw the need and saw the opportunity to build her career by going into psychiatric nursing, and really good timing because in our budget just yesterday, $1 billion for mental health and addictions facilities, for resources for nurses like Sherwin and her colleagues, psychiatric nurses in that room. It was a pleasure to see them and an inspiration to see the kind of work that they're doing. Now, I know, like the Prime Minister does, these past few years have been incredibly difficult for healthcare workers, and it's been hard on British Columbians too. The pandemic, combined with the rapid growth in population here in British Columbia, record-setting growth, has meant that too many British Columbians looking for a family doctor can't find one, concerned that if they get sick, they go to hospital, they may not get the care that they need. That is unacceptable, and we are moving in partnership with the federal government to address it. I know about this from British Columbians directly, but I hear about it at home too. My wife, Kaylee, was a registered nurse. She went back to school to become a family doctor. She sees the challenges firsthand, and she reminds me all the time at home that we need to keep doing this important work. Some people out there say that the answer to our problems lie in privatized healthcare. That if people could buy their way to the front of the line, that somehow the line would go away. Or if we pulled doctors and nurses and health professionals out of our public system into a parallel private system, somehow that would improve care for everybody. It doesn't shorten the line, it just changes who's at front, and it puts added strain on our public healthcare system. That's not the direction we're going, and it will not be under my leadership. Healthcare that you can count on is a priority for me and for British Columbians, for our whole government. In our budget yesterday, we included, among other things, a new 10-year BC Cancer Care Plan with hundreds of millions of dollars dedicated to make sure people have access to cancer care across the province. Training for thousands more healthcare workers like Sherwin, like Alita, so that they can take the pressure off the front lines. And more than $1 billion to strengthen care for people struggling with mental health and addictions. But we do know there's a lot more work to be done. Today, with the federal government, we are taking that big step towards protecting and strengthening public health care in our province. That's public health care that all British Columbians can rely on. Having the federal government as a strong partner with an agreement in principle that we're announcing today means that we're able to ensure stable, secure funding going forward. Another $6 billion to stabilize healthcare in our province, and more than $3 billion over 10 years for targeted funding in priority areas where we agree with the federal government more needs to be done. Expanding access to family health services, including in rural and remote areas. Reducing backlogs, better supporting BC's healthcare workers. Modernizing how we track and report our healthcare data. Improving access to mental health and addiction services, and supporting investments in long-term care and home care for all British Columbians. We're also focused in parallel. We know, as the federal government knows, this isn't just about money. This is about being more efficient and making sure we don't have people waiting on the sidelines that could do work for us right now in our communities and in our hospitals. That's why we're fast-tracking immigration pathways for healthcare workers like nurses and doctors. By getting these internationally educated doctors and nurses off of the sidelines and into our healthcare system, we'll create better results for British Columbians. As we know, there's about 2,000 nurses right now in a line at our College of Nursing, where they want to get assessed to know what courses they would need to do at KPU, or whether they can go directly into our healthcare system. Previously, they had to wait 2 or 3 years for that assessment and pay a number of fees in order to get that done. We've waived those fees, and we've worked with the college to get that down in 9 months, and our target is 3 months by the time that program is done. We've done similar work with the College of Physicians. British Columbians should feel confident knowing that we're working in close partnership with the federal government and with healthcare workers to strengthen public health care. We're signing on to a flexible funding agreement with the federal government here that will provide made-in-BC solutions because all provinces have different needs and BC is no exception to that. Clear action plans and specific targets that we will hit. So everyone in BC has the same peace of mind. You and your loved ones will be able to get the care you need when you need it. Today is an important step forward on our shared journey with the federal government. It builds on the work our province has already done and will continue to do to strengthen healthcare. Building and improving hospitals, opening urgent and primary care clinics, hiring thousands of nurses, implementing a new deal with family doctors, getting more internationally trained doctors and nurses into our hospital. There's so much more work to do and more to come. If there's anything we've learned over the last few years together, is that we can't go it alone. We have to do this work together. Canadians from coast to coast to coast. Canada's universal public healthcare system is one of our great achievements as a nation. It's key to building a good life for yourself and for your family. our government is going to keep working hard for British Columbians. And we've got a strong partner in the federal government, and we're counting on them to keep working with us because we're going to keep working with them. I look forward to what we can accomplish together. Thank you.
We will now start the question period. Nous avons 20 minutes pour des questions. We have 20 minutes for questions. I'll turn it over to the first question.
I guess that's me. Prime Minister, Belle Puri, CBC, The National. Further to the Han Dong matter, since 2019, what have any national security agencies told you or your party about other Liberal candidates or MPs being under surveillance? And English et en français.
Thank you very much. I think we've seen over the past number of days and weeks many Canadians very concerned about the issue of foreign interference into our democracies, into our election processes. We share that concern. This is an extraordinarily serious issue. And to reassure people, we've been taking it seriously since back in 2015 when we got elected. From the very beginning, we noted as we saw increased election interference from countries like China, Iran, Russia, and others in democracies around the world, we knew we needed to step up Canada's tools to counter foreign influence and interference in our democratic processes. So we did. We stepped up to create a protocol for the 2019 and 2021 elections to notify Canadians in the event our ability to have free and fair elections are threatened. It includes a panel of senior public servants informed by national security agencies and reviewed after every election. The latest review on 2021 just came out and confirms that our election integrity held in 2021 as it did in 2019. When we were hosting the G7 in 2018 in Charlevoix, we created a rapid response mechanism for democracies to be able to move quickly against foreign interference. We moved forward with a digital citizen initiative that is allowing Canadians to be more empowered to see misinformation and see the impact of foreign governments in what we're doing. In 2017, we created a National Security and Intelligence Committee of parliamentarians to be able to have parliamentary oversight by all parties over our national security agencies. This was something that we had argued for against the Conservatives when they were in government for many years, and we were able to bring that in, and now NSICOP has the capacity to look into election interference and have the top secret clearances necessary to see everything that's being done. These are the kinds of things that we have been doing from the very beginning. In 2018, we passed legislation that strengthens election financing laws to keep foreign money out. This past June, we introduced legislation to protect cybersecurity, and we're working on creating a foreign agent registry. So we have been taking this issue extraordinarily seriously. We've been empowering our national security agencies and officials to pursue the issue of ongoing interference. We have been speaking about the dangers of foreign interference since well before the 2019 election, and we will continue to step up on this. Right now, as we speak, in Ottawa, there's a parliamentary committee hearings going on where our national security agencies and officials are testifying to what happened, what's been going on, what they've been seeing in an open and transparent way, because we need to keep doing two things. We need to keep making sure that our agencies and our officials have all the tools necessary in an independent, nonpartisan way to ensure that our democracy and our institutions hold and our elections remain free and fair. And secondly, to make sure that Canadians can continue to have confidence in our institutions, in our democracy, in our elections. That's what this government has done from the very beginning. It is a responsibility we have always taken very seriously, and it is one we will continue to uphold. Je comprends à quel point les Canadiens sont inquiets, même perturbés par les différentes nouvelles qu'ils entendent depuis des jours et des semaines par rapport à l'ingérence et l'interférence par la Chine et d'autres pays dans nos processus démocratiques, dans nos élections. Nous partageons ces préoccupations. En fait, nous partageons ces préoccupations depuis qu'on a formé un gouvernement en 2015. On a reconnu que, d'une part, il y a de plus en plus d'ingérence par les pays comme la Chine, comme la Russie, comme l'Iran et d'autres dans nos institutions et dans nos processus démocratiques. Et d'autre part, on a reconnu qu'on manquait d'outils pour contrer cette ingérence et pour défendre notre démocratie quand on est arrivé au pouvoir il y a 8 ans. C'est pour ça qu'on a créé énormément de différentes institutions et d'outils pour que nos experts en sécurité nationale puissent faire les suivis nécessaires, puissent rassurer les Canadiens qu'on est là pour contrer l'ingérence et surtout souligner que nos élections demeurent intègres. C'est quelque chose d'extrêmement important. On a créé un comité national de parlementaires en enjeux de sécurité nationale pour que les parlementaires de tous les partis puissent regarder les documents les plus classifiés pour savoir ce que nos agences sont en train de faire. On a mis en place un panel d'hauts fonctionnaires qui ont la responsabilité de veiller avec nos services de renseignement sur le déroulement de nos élections. On a donné plus d'outils à nos agences de cybersécurité et nos institutions démocratiques. On a changé les lois électorales pour empêcher le rôle d'argent étranger. Et on continue de prendre des mesures importantes. On est en train de voir actuellement, en comité parlementaire à Ottawa, nos experts en sécurité nationale témoigner sur tout le travail qu'eux, ils font depuis des années pour assurer la protection de notre démocratie. Mais je peux vous souligner que nous allons toujours prendre ça extrêmement au sérieux. Nous l'avons pris au sérieux en agissant de façon jamais vue au Canada pour se doter de plus d'outils et on va continuer de le faire à chaque étape.
Next question.
Hi, it's Derek Penner, Vancouver Sun and Province. It's another question for the Prime Minister. Post News has learned that that parliamentary committee today will be asking government to call a national inquiry, a nonpartisan national inquiry into the issue of potential foreign influence into elections. How will your government respond to that request?
I think one of the most important things to remember is we have an awful lot of mechanisms that are underway right now around determining what kind of foreign interference has happened, is continuing to happen, and demonstrating the tools we have. Right now, as we're speaking, our parliamentary committee is hearing directly from national security experts and officials as to the work that they've been doing over the past many years to counter ongoing interference. We also know that the National Security Committee of Parliamentarians is going to dig into this question, as they have in the past as well. There are multiple processes ongoing. There are a report that just came out, an independent report that just came out on the functioning of the High Panel for election interference. But we will continue to do what is necessary to reach those two clear goals that Canadians can expect. First of all, that our agencies and officials and institutions have all the tools necessary to safeguard our democracy and our elections. And two, that Canadians can continue to have confidence, not just in our national security officials, but in the integrity of our democracies. We will continue to work to make sure that that happens.
Follow-up.
I have a follow-up question for Premier Eby. In the health agreement, our understanding is that there is a immediate more than $200 million contribution to the agreement. How will that be prioritized in BC? There's a lot of rural ERs sort of closing on weekends.
Thanks. We know that that the acute situation in many of our hospitals and is particularly challenging in rural communities, where communities have lost doctors, where the strain following the pandemic has hit particularly hard. There are two components to the additional money brought to the table by the federal government for our healthcare system. There's a $200 million component that is immediately available to the province. This money will go to absolutely supporting emergency care in the province, supporting strained hospitals. It is in the context of a budget yesterday where we announced $6.4 billion over the next 3 years for our healthcare system. So I want to certainly express appreciation for the federal government's partnership, because that money is one small piece of what we're announcing today. What the federal government is committed to for us is stable funding for the next 10 years for our healthcare system, and that is critically important for us for planning and moving forward. Additional money for shared priorities, which are things like long-term care, mental health care, and other pieces, as well as that $200 million. In terms of the situation faced in our hospitals, especially in smaller centers, the piece that's really going to make the difference here is about getting the people with the skills that are on the sidelines right now into our healthcare system. So the agreement we reached with the College of Physicians and Surgeons, where internationally trained doctors that have the expertise can work under the supervision of a BC doctor immediately and get to work in our hospitals, in our care centers, and also the 90 additional spots for internationally trained doctors to get their skills up to speed to work in BC hospitals as quickly as possible. Those have a return of service component where they work in rural communities. That's where we're going to see the traction, and that's where we're going to see the reversal of some of the challenges we've seen coming out of the pandemic of stressed out healthcare workers, that especially in rural communities where they are the front line, facing very serious demands, where the support and relief is going to come for them, and by extension for the people in the communities that are counting on them.
Next question.
Bonjour, Willinette Paul de Radio-Canada. La question sera pour vous, Monsieur Trudeau. Les trois partis d'opposition réclament la tenue d'une enquête publique sur l'ingérence de Pékin dans les élections de 2021, mais vous seul êtes en mesure, avez le pouvoir d'en déclencher une. Alors, est-ce que vous vous engagez à déclencher une enquête publique?
Je pense que tout le monde est d'accord que c'est un enjeu extrêmement sérieux. L'ingérence dans nos élections, dans nos institutions démocratiques, on en parle en tant que gouvernement depuis des années. On a mis en place des mécanismes et des outils, dont le panel de hauts fonctionnaires, dont le groupe de travail de nos services de sécurité de renseignement, un mécanisme du G7. On a mis en place un comité de parlementaires pour traiter avec des enjeux de sécurité nationale. Et tous ces autorités indépendantes et non partisanes sont en train et travaillent sur ces enjeux-là depuis bien des années déjà. Nous voyons d'ailleurs le résultat du travail qu'a fait le panel pendant les élections en 2021 avec le rapport qui vient d'être partagé hier avec le public. Et aujourd'hui, en public, un comité parlementaire est en train d'entendre directement de nos experts en sécurité nationale, des différents fonctionnaires qui sont chargés de ces tâches-là. Il y a énormément qui est en train de se passer en même temps et on va laisser ces processus continuer. Mais évidemment, on va toujours être là pour en faire plus et plus pour outiller nos agences de sécurité nationale pour pouvoir contrer ces menaces récurrentes à la stabilité et l'intégrité de nos élections, de notre démocratie par la Chine et d'autres pays, mais aussi pour rassurer les Canadiens que nos institutions sont intègres, que les élections en 2019 et 2021 ont été intègres. Et ce n'est pas juste moi qui le dis, c'est même pas moi qui le dis, c'est les experts en sécurité nationale qui ont travaillé sur cet enjeu-là de façon façon experte et non partisane pendant les élections pour que les Canadiens puissent avoir cette confiance.
Question suivie.
Alors, sur l'enquête publique, est-ce que vous vous engagez, oui ou non, à en déclencher une?
On a actuellement énormément de processus publics qui sont en train de se tenir. Un comité parlementaire, un comité de parlementaires sur la sécurité nationale qui a la capacité de se pencher sur les enjeux top secrets et classifiés. On a un rapport de ce haut panel de fonctionnaires qui vient juste d'être partagé avec les Canadiens, que les gens sont en train d'étudier maintenant. On a énormément d'étapes et on est toujours ouvert à en faire plus pour aller résoudre ou répondre à ces deux préoccupations que les Canadiens ont, que d'abord nos institutions soient robustes et outillées pour contrer l'ingérence étrangère et que les Canadiens soient rassurés de l'intégrité de nos élections et de nos processus démocratiques.
En anglais pour nos collègues.
Next question.
Next question.
Thank you, Brenna Owen with the Canadian Press. We've touched on some of this, but I do have a question for my colleagues in Ottawa. In his report on the critical election incident public protocol, Morris Rosenberg recommended Ottawa explore lowering the threshold for when to notify Canadians about potential interference in an election campaign. Are you open to the public being notified about this interference during a campaign, even if it involves like one riding or community?
The panel on election interference looks at the whole of the election in all ridings at the national level, but also looks at what's happening on the ground in particular ridings, because Elections Canada and CSIS and our security agencies are constantly working together to ensure that everywhere our institution is strong and our elections are fair. We are absolutely very much looking at the recommendations that are put forward in that report. They are important and excellent recommendations. On every single one, there are lines to be drawn. There are consequences for moving forward on them that have to be carefully looked at. The impact of an announcement of a threat of interference in the middle of an election campaign could be difficult to measure, and we have to make sure we're getting it right. But there are very, very good questions posed in that report that we're going to study carefully, and then I certainly expect that we will have many conversations on, not just as a government, but as a society, on the best way to empower Canadians to go into the voting booth with full understanding of what's going on and what pressures may be brought to bear on them in misinformation and disinformation and interference, while at the same time not being seen to tip the scales one way or another because of concerns that people are highlighting. It is an important thing to get the tools right to protect our democracy, and I thank Mr. Rosenberg for his hard work and all his recommendations. We will look very carefully at them, and we will continue working on them with Canadians.
Follow-up question?
I am going to just stay with the report. It says the risk, quote, that withholding information and having it come out after the election would decrease public confidence in the government's approach to countering election interference. Do you share that concern given the recent allegations?
These are all concerns that we have. There are no easy answers when it comes to where one draws the line on that. That's why we put those decisions in the hands of independent public servants, not in the hands of political parties. Not just because we can trust independent public servants, but also because Canadians will want to see objective measures as interference is countered and publicized. These are very serious questions to study, and we are absolutely looking very, very carefully at all the report's recommendations.
Last question.
For the Minister, this is Julie Nolan from Global National. When did you first learn of the CSIS allegations concerning Han Dong's alleged connection to China's election interference network?
The national security agencies in this country have been dealing with foreign interference for a very, very long time. And as a government, we've been talking about the impacts of foreign interference on Canadians for many, many years, even as we're building up more and more tools for our institutions to defend ourselves, for our democracy to remain robust. And it's important to highlight that the greatest targets of foreign interference are diaspora communities themselves. The Chinese government goes after Chinese citizens and Chinese parliamentarians. The Iranian regime goes after the Iranian diaspora. Russian speakers are more exposed to Russian misinformation and disinformation online and on the web. Every step of the way, we have ensured and continue to ensure that populations that are particularly vulnerable to foreign interference by problematic state actors are properly supported and properly informed of the risks that they are being targeted. This is something that we will continue to do.
Follow up.
Do you feel you should have been briefed about the allegations against Han Dong?
As I said, as a government and as parliamentarians, we are constantly being engaged with by our security agencies around how to keep safe from foreign interference, how to make sure that we're able to stand and speak for our communities as members of parliament without having to be impacted by state actors from other countries, like China and others, who are specifically targeting Chinese Canadian communities or Iranian Canadian communities or others. This is one of those things that this government has taken more steps on than any previous government, and we will continue to take this issue extremely seriously. It's not a question of partisanship or partisan gain, as we are seeing somewhere in some of the comments out there. This is about all of us standing together for the integrity of our democracies, of our institutions, because that's what Canadians can and must expect from their governments.
This concludes our press conference. Ceci conclut notre conférence de presse. Thank you for your participation.